Last week I said how that we had put on ice many of the Budget 2020 new initiatives that we had planned before COVID-19 to focus our investments on our response to this global pandemic. There are some things, though, that you do not put on ice. They are more important than ever.
We are investing $3.92 billion over the next 4 years into our hospitals and the DHBs that run them. That's an extra $980 million a year and takes the annual budget for DHBs to more than $15 billion for the first time. This is the biggest funding increase in a decade in both real and percentage terms at 9%, and builds on significant increases in the last two budgets, which were also the largest in a decade. This funding will support DHBs to improve their financial sustainability and clinical performance. It will enable them to meet costs related to a growing and ageing population, as well as already agreed wage increases. Of course, it is no secret that a number of our DHBs are running significant deficits. This funding boost won't fix that overnight. It will take years to rebuild our hospitals and health services. But I do want to be very clear. As Health Minister, I do expect DHBs to work on improving their financial performance, as well as continuing to deliver quality care and improved health outcomes. And not so long ago, I had a significant influx of new governance into our DHBs to help with that effort. And Minister of Finance, let me assure you I will be holding our DHBs to account on this. As the government has already shown, we are willing to step in where we don't see that improvement happening. We can see this in the Crown monitors that have been put in and the Commissioner at the Waikato DHB. I'd like to say a few words now about the second part of today's announcement, more funding for planned care, which includes elective surgery, radiology scans, assessments and follow-ups, and procedures completed in outpatients facilities. Although critical and urgent care continued even under Alert Level 4, we know that many New Zealanders had procedures delayed. The good news is that our hospitals are now returning to a more normal level of service, but it will take time to recover and deal with the backlog. We don't want people having to wait for care any longer than necessary. So we're making a one-off investment of $282.5 million in planned care, including $50 million of capital to expand theatre capacity. This extra investment will fund an estimated 153,000 surgeries and procedures, radiology scans and specialist appointments over the next 3 years. Let me be very clear. This is care that will be provided over and above business as usual in the current arrangements. That is being accounted for with an ongoing investment of $125 million over 4 years to cover the impact of demographic changes and increased costs.